You know you're ready to feel strong in your body again. And you know that you want to make sure that whatever you do is going to be right for you. So I'm going to walk you through the next steps that you can do to start healing yourself from the inside out. Hello, my name is Dr. Kristina Turkewitsch, and I am a corrective care chiropractor in Newmarket, Ontario, Canada. I help women over 40 feel strong in their bodies again by treating the root cause of disc pain and not just covering it up. Today I'm sharing how a custom chiropractic plan can help women heal their discs naturally without drugs or surgery. So ladies, you know the cycle, especially for women over 40. You know, you injure yourself and then you're in pain. Or maybe you haven't had a specific injury, but the pain just came on over time and has gotten worse. And then one day it just hasn't gone away. You try all kinds of at-home treatments and exercises, but nothing really has been able to give you meaningful results. Then the pain starts getting worse, so you start to look for help. You may try an osteopath or a physiotherapist or even a chiropractor, and maybe you're able to get some relief, and then you feel like you're starting to heal. But then, 2, 3, 4, or 6 months down the road, you're back to square one, and you're in the same situation with the same pattern, and you just can't seem to get out of it. What used to work just isn't as effective anymore. If what I described is you, then this corrective program might just be what you need to heal. This type of program helps to break the cycle. This type of cycle unfortunately happens because a lot of the time what is being treated is just the symptoms and not the root cause of the problem. Now, the corrective type of treatment plan is good for treating many different kinds of issues related to the spine, the nervous system, and posture. Things like degenerative disc disease, degenerative joint disease, disc herniations, disc bulges, chronic back pain, as well as scoliosis and spinal stenosis. The aim is to get to the root cause of the problem, which the majority of the time is due to spinal misalignments. These spinal misalignments or subluxations cause the spine and the nervous system to compensate. The ultimate goal is to improve the spine and the nervous system function, aiming for long-term relief, improved longevity and vitality. So you don't go through the same patterns of injury, pain, treatment, healing, and then re-injury. So let's start to break the cycle right now. My approach is a little bit different than other practitioners because I focus on the structure. Taking a structural point of view or perspective allows us to assess the body as a whole instead of just looking at the individual parts and problems. The thing is that everything is connected. So if you have a problem in one area, you most likely have a problem in another area. It's just you don't have any major symptoms yet. Compensations always translate through the body. So you can't only just treat one area. That is why I love this technique, because we can see how everything works together and how affecting one area will affect other areas as well. So one of the primary techniques I use is Thompson technique, which is an adjusting technique, but I also use a technique called Chiropractic BioPhysics. So this technique is a research-based and structural-based technique focused on restoring the ideal spinal alignment through mirror imaging adjustments, specialized traction, and exercises. Unlike traditional types of care, which focuses only on pain relief, CBP aims to correct posture to improve nervous system function, reduce chronic pain, and restore lasting long-term health. It combines biology, physiology, physics, and geometry to analyze and correct spinal structural issues. So I want to move the spine from its current subluxated state towards a model or ideal alignment, which improves mobility and reduces pain. So mirror imaging adjustments basically corrects and adjusts people into the mirror or the opposite direction of the subluxation or misalignment. So we use specialized equipment like traction devices to help renew the proper spinal curvatures. And the targeted exercises help to reinforce the postural corrections. So what I love is that CBP goes beyond temporary relief of pain to provide the structural rehabilitation and stability to ensure improved and long-lasting and better functioning health outcomes. So with this type of care, I would tailor the plan to your specific needs, and I would take into account your spinal posture and your physical posture and adapt it to what is necessary so we can see nice changes in those. So you would get a certain number of chiropractic adjustments, mirror imaging adjustments, tractioning protocol, and exercises for postural correction. So for example, this person here came in with a pretty significant disc herniation. And you can see here in the left side picture that the spine has significantly deviated. So this is their first x-ray. We did take x-rays on the initial assessment with them. And we could see this significant shift in the spine as a result of the injury there. And after a specific tailored program, we were able to get them back to normal. So you can see on the right side, the spine is now straight. And so this is just one example. There are multiple examples that I could show, but I just wanted to show one specifically where you have a really good view. And so now they're doing quite well. So if you've been watching this and thinking, this sounds exactly like me, I want you to hear this clearly. Your body isn't broken, and it's not something that you just have to accept as part of getting older. Most of the women I've worked with have tried stretching, massage, rest, and even medications, but no one ever showed them why their back pain keeps coming back or how to correct it at the root. In my office, I work one-on-one with women over 40 using a personalized corrective chiropractic care plan. We focus on posture, alignment, and restoring strength so your body can heal the way it was designed to. My goal isn't just pain relief, it's helping you feel strong in your body again, so you can move with confidence and not wake up with stiffness holding you back. If you're ready to stop guessing and want a specific plan designed for your body, I'd love to invite you to book a consultation with me. So you can click the link below. You can either book an in-person consultation if you're able to make it into my clinic, or you can book a 15-minute phone discovery call with me, and we can go through and see if this is the right care plan for you. If this message resonated with you, don't ignore that nudge. Sometimes that's your body just asking for support. If you're ready to finally feel strong, stable, and pain-free again, click the link below and let's get started.